Research that touches lives, held right here at the stage Aras Plaza UMMC on the 26th and 27th of August 2025. This program is proudly organized by the Clinical Investigation Center, CIC, in conjunction with UMMC's 57th anniversary. Over these 2 days, we will be bringing you inspiring on-stage conversations with our very own doctors and researchers. They will share in clear, engaging language how their discoveries, challenges, and hopes for the future of healthcare are directly making a difference in everyday life. Each dialogue will be followed by an open Q&A session, so we warmly invite you to take part, ask questions, and join in the conversation. This is a chance for all of us to see how UMMC's research truly touches life, not just within hospital walls, but in community. So sit back, be inspired, and enjoy this journey. Allow me to introduce myself. My name is Wadiza Hadira, and I am the legal officer from the CIC, and I will be your moderator for this morning's session. Now let us begin with our very first session. We are honored to begin with our first speaker, Dr. Nicholas Yoong, Endocrinologist and Internal Medicine Consultant at UMMC. Doctor, we join you to welcome you to the stage. Alright, Dr. Nicholas has published widely in the fields of endocrinology and diabetes with a particular focus on complications of type 2 diabetes. Dr. You can see. His research bridges advanced imaging, artificial intelligence, and clinical practice, always with the goal of improving patient outcomes. Recently, his research poster on AI echocardiography won second place at the Malaysian Endocrine and Metabolic Society Annual Scientific Meeting. He continues to drive innovation by harnessing technology to improve early detection of heart disease in patients with diabetes. And today, Dr. Nicholas will be speaking on the topic AI echocardiography for early heart failure detection in diabetes. Alright, doctor, so we know that diabetes doubles the risk of heart failure, often before symptoms appear. Echocardiography can help detect this early, but it is costly and complex. Dr. Nicholas' research explores how artificial intelligence, or AI, can make this tool easier to use and more accessible, paving the way for timely diagnosis, early treatment, and ultimately saving life. Ladies and gentlemen, please join me in giving a round of applause to Dr. Nicholas Yoong. Alright, doctor.
Thanks.
So we may begin with our talk. Alright, so doctor, I believe you have made a research about the AI echocardiography machine. Will you wish to show the video now or later?
We can show it later, but maybe I just give a bit of introduction into how the research started about and how we got into it.
Sure.
Basically, we were introduced to this concept about heart failure diagnosis, early heart failure diagnosis in diabetes, not that long ago. So as early as maybe about 3 to 4 years ago, there wasn't even any research or guidelines to talk about early diagnosis of heart failure in diabetes. We just knew that diabetes gives you a higher risk of heart failure, but we never really figured out that there was a way to diagnose it. The normal way people diagnose heart failure in the past is if you have a patient who comes in with shortness of breath, and then you will refer, you'll do an X-ray, you will see they have a big heart or their lungs are full of fluid, and then these patients get referred on to a cardiologist who then confirms the heart failure. But we were thinking that researchers around the world were thinking there has to be a better way, a faster way to be able to predict who among all these patients with diabetes will develop heart failure. You don't just want them to come in when they are already ill and symptomatic and have already have heart failure. So people have been doing a lot of echocardiography early. So even in patients who don't really have any symptoms, but they have risk factors like they have one blockage in the heart, scans to figure out is there some early markers to pick it up or not. And generally there are some early markers that they found can predict who will develop heart failure. But echo is very technical, you know, right? So it's a skill that requires years of practice. You know, we have our echo technicians in Aras who are training for years and years, not only first to pick up the image, but also to understand what they're looking at. Most people look at the image and don't really understand what they're looking at, right? Just black and white spots on the screen. So now AI has enabled us to not only get these images faster, even if you are not as well trained as our very good echocardiography technicians, but also interpret the images faster and quicker, even though you don't have as much training. So that's how the idea came about, and that's what we are trying to learn about research.
Right, so we're talking about AI nowadays, right? So do you think how close are we in seeing this AI being implemented into our everyday clinics and hospitals?
Well, I can only talk about our in my practice. So what we have tried to do in our research basically is try to use this AI technology, so use a device that is AI enabled to teach, to enable less trained doctors. So like myself, I'm not a cardiologist, I don't really have formal echocardiography training, and the people who study, who are doing the study with me, my co-investigators, also are not most of them are not cardiologists. So we have cardiologist trainers for a few weeks in how to obtain some necessary images to that are able to be interpreted. And what the device does, what the AI algorithm allows us to do is tell us whether the views that we got in our echo is optimal views or not, they are good views or not. And then later on we are able to upload these images, and AI helps us interpret them. It helps us tell me whether there are signs of early heart failure or whether there is not early heart failure. So how early are we to implement this in our practice? I would say we are not that far away. Actually, there are other centers around Malaysia who are using this kind of technology, who they either use it in the context of a health screening. So this is something that IJN does, I believe. They use it in the context of they go out into the community with this small handheld AI echo device. And because cardiologists can't be standing, 10-15 minutes with each patient to scan, you just obtain very quick images with AI echo, and the report comes out very quickly. So within like 10 minutes, patients are out there with a full echo report, and doctors are able to better understand them. And also overseas, how people are implementing it is that it reduces a lot of mental burden for echo technicians. So they're just able to report echoes faster and report images faster. In the local context, I think that's the point of our study. We want to see whether this AI echo is something that's acceptable to not only cardiologists but also acceptable to the public. Let's see what the feeling is and the uptake is, and whether or not it's ultimately cost effective or not. I think it's something that's important for us to investigate before we start.
I believe do you want to explain how the machine works?
Sure. Okay. So maybe I can have the video up now. Just give us a rough idea of how the machine works. So there are two areas in which the AI algorithm works. Okay. First of all is allowing good, easy ways to obtain the image. So what happens is that when you have the operator, let's say myself, I scan an echo image, but I don't really know what I'm looking at. Okay. So when I put the probe, actually what the AI echo is able to help me to do is it points out to me, you're looking at the left ventricle, this is the left ventricle, this is the left atrium, this is the structure of the heart that I'm looking at. And it actually tells me that whether the image I'm obtaining is a good image or not, okay, by showing me green bars and red bars and telling me whether this is an optimal image for viewing or not. So that is the first way that AI is integrated into the system. And the second way that AI is integrated into the system is that for reporting. Okay, so I'm able to capture the images and upload them. And when I'm able to upload them within 10 to 15 minutes, I get a full report for them. So do you have the video? Okay, so this is a video of one of my study coordinators obtaining image. So you can see how he's scanning the patient, and you see how it's quite faint, but can you see how there's a green bar over the echo image image up there. It's red now, but it turns to green. So this is indicating to him that as he adjusts the probe, the image that he's obtaining is a good image or not. So when he's able to obtain the green bar and he knows he's getting a good image, then he saves that image and that image is later able to be uploaded. So as you can see, it's quite a small device. It is a device that can be brought around. You know, our typical echo machines are generally very big and bulky and are not so accessible and very expensive actually. A lot of our conventional echocardiography machines cost in the 6 digits, hundreds of thousands. Whereas a smaller device like this would probably cost a lot less and enable us to not only churn out results at a faster rate, but actually potentially also at a cheaper, more cost-effective rate.
So I heard that you mentioned even the nurses can operate this machine, and we did not always require doctors to use this machine. So what do you think? Like after this, is it that doctors are no longer required in terms of like detecting early signs?
Well, I would say that that would be, of course, if the AI was that advanced, we might be heading in that direction, but we're not there yet, honestly. Yeah, the AI echo actually requires quite a significant amount of practice and skill. So for me, for myself, it took me around 3 or 4 sessions with emergency physicians, with cardiologists, to give me tips on how to obtain the good images. With a lot of our study coordinators, it takes them maybe also around 3 to 4 to 5 sessions to be able to properly pick up images. But actually, it's interesting you mentioned nurses because there was a study that was done. It was a nursing lab study. I believe it was overseas, somewhere in Europe. And what they had was they had 8 nurses and they gave them a 2-day course on echocardiography. So they basically taught them over 2 days how to obtain images. And then they sent them out into the community with this device and with the AI technology. And from that study, around 70% of the images that the nurses were able to capture could obtain results that could be interpreted by cardiologists. So actually, with proper training, there is no reason why with this AI technology, that it's only doctors that can do scans. In fact, I mean in our hospital, also the majority of scans are done by trained technicians, and I think that it really removes a lot of barriers to be able to obtain these images and to be able to interpret these images.
I think you might want to share how the patients responded to this newly implemented AI technology.
Actually, we had quite an easy time with recruitment, surprisingly. We were targeting 100 patients to be able to be recruited. And you know how things work. Sometimes in busy clinic, patients are quite in a rush to leave the clinic or to come in and see the doctor. But actually, when we told the patients about our program and told them the kind of benefits that you get, it's a very quick study, and immediately on the spot we will give them a rough idea of how the heart function was doing. Actually, we had quite good response. There were very little patients who turned us down, and within 1.5 months we were able to complete our recruitment. So it seems like at least general patient acceptance to do something in the hands of a doctor seems to be quite high.
As someone who actually assisted in research, because I'm the legal officer in CIC as well, so I think this is so helpful in your research, because recruiting patients is quite hard.
Oh yeah, definitely. I mean, this is not the only study I'm involved with. Other studies, sometimes we really have a lot of trouble, especially when it comes to things like diabetes, especially experimental things. When it's something new, patients are always like, oh, they're using me as a injury, that kind of thing. But actually, in this particular case, because the test is not invasive, and of course under the study I realized free of charge, but in the long term, I'm seeing that there is potential if we are able to roll it out, hospital-wide. There is potential for a lot of cost saving, not only to the hospital but also to the patients themselves, and also time saving as well. Because how patients get echo now is, let's say in my endocrinology clinic, let's say I see a diabetes patient and I want him to get an echo now, I put in the order form, and the patient will have to walk all the way up to the cardiology lab to get his appointment, and then come back another day to do the scan, and then come back again and another day to review the results of the scan. So So that's 3 visits, right? And potentially with this kind of technology available, you could shorten all that to 1 visit, right? Because we see the results immediately, and the doctor could even act on it immediately and refer to cardiologists on the same visit. So it not only shortens, the parking you have to pay, it not only shortens the amount of time it takes to drive to the hospital, park in the hospital, you have to do that 3 times versus coming 1 time. I think there's a lot of potential patient benefit there.
Thank you so much, Dr. Nicholas, for that very eye-opening talk. So we will now open the floor for any questions. If you have any questions, please come forward to the microphone provided at the center of the hall.
Hi Nick. So actually I have a very curious question about where do you think this puts our echo technicians in the future? Are their jobs in jeopardy? What do you think?
Yeah, actually, how people have implemented it in other centers is the echo technicians actually use the AI echo technology. So actually it cuts down on a lot of, they say that when they ask the echo technicians how they feel about it, the echo technicians actually feel quite happy. Because you don't have to second guess yourself when you're doing echo. Sometimes when they do echo, a lot of the echo technicians say they feel very lonely because they are the only one looking at the image, and then they are the only ones interpreting it. So they are directly giving a diagnosis to a patient, and there's no one really backing you up unless you call another echo technician, you call a cardiologist to review your image again. So actually, what a lot of them have said is that it gives them a lot of confidence. You scan something, you believe that is the case, and the AI echo backs you up. So actually, there is a lot of the echo technicians a lot of the echo technicians that are doing overseas actually said it reduces mental burden, it reduces a lot of waiting time for them to generate reports. And like I said, it's quite technical actually. In doing this study and in obtaining the images, we had so many times when we were doing it, and then the images are suboptimal, and then we have to do it again. So I think there's still at the moment no substitute for expertise, and there's definitely still need for the trained echo technicians, but actually rather than replacing them, I think it will complement them. It probably will reduce a lot of waiting times potentially. That's what we want to do for. Thanks so much.
Do we have any other questions to Dr. Nicholas?
Hi, Dr. Nicholas. Actually, I want to ask, for this AI echo, actually, is it recommended to be used by doctors from other subspecialty, or nurses, or even housemen, for example? Do you recommend them to use it?
So I would say there are we don't have any reservations, there are no problems with other people using it as long as you are able to learn to obtain images, right? So that will require a little bit of training. So in the future, I think when the time comes for us to officially implement this in service, all the doctors who will use the technology will probably need to undergo some training, right? But as long as you do undergo the training, it doesn't matter if you're a medical assistant or you're a houseman or you're a doctor, not even from medical, even if you're a surgical doctor, is this something that you want to, because the surgeons are always asking for echo, right, before going in for surgery and all that. Potentially this is something that can offer an easy gateway into obtaining quick images, and hopefully with quite a lot of reliability. I think that's the main question that we always ask when it comes to new technology. Are these results reliable? Are these results reproducible? And generally what we are finding is that a lot of the research tells us that they are, right? There's a Lancet paper in 2022 which shows that the correlation is 91 to 99%, really, really high. But this is also with trained hands. You can't expect somebody to just pick up the machine and do it on the first try. But if somebody has been trained to do it, there's no reason why you need to be a particular specialty to do it. So that would be the hope for the future.
I think we can spare more time for any questions. More? We still have time.
Morning, Dr. Nicholas. I just want to inquire regarding what is the price for the echo machine, and is there any discrepancy in the AI interpretation in if you compare with normal operator, echo trained personnel using the echo machine?
Yeah, thanks for the question. I think a very important question. First of all, we'll address the question about price. Because it is a software, or rather it is a proprietary algorithm at the moment, this AI echo. So we will have to upload all images into the cloud, and the cloud is owned by somebody, and the cloud is owned by the developer of the software in Singapore. And so they sell it by license. Okay, so the license out, usually a normal standard license is about 1,000 patients, 1,000 participants, and so they give you 1,000 reports basically. You can upload as many images as you want, but you generate 1,000 reports. One report, from just rough calculation, one report is probably going to cost around 20 ringgit. On that street. That is a lot less compared to what we currently charge patients in UMMC. One echo generally here is around 120 ringgit. Yeah, so potentially there is quite a lot of cost savings here. The initial cost will, I think, come down to the cost of the device. So technically you can use our big echo machine to obtain the images and upload it to the cloud. But I think where this small device benefits us as non-cardiology trained doctors is that it can guide us a little bit when we need the big echo machine cannot. And that device, I believe, costs around 50 to 70,000. But there is still a lot less compared to what the conventional echocardiography machine would cost us. So potentially there is quite a fair bit of cost saving here. And as for the next question, do we see a lot of discrepancy between echocardiography done by our study versus those done by technicians? That's something that's looked into in my study. We do see some discrepancy. Okay, it's not always concordant, but usually the discrepancy is in terms of severity. So maybe echo picks it up as a bit more severe, and then the conventional echocardiography picks it up as a bit less severe. If you look at most heart failure guidelines and diabetes guidelines, actually you don't see echocardiography featured very high in the algorithm. So a lot of diabetes trained doctors will know that if you have a patient with diabetes, the American Diabetes Association recommends a blood test instead of echo for screening. The blood test called NT-proBNP. Okay, so this blood test is basically able to detect. The best function is to detect who doesn't have heart failure. Right? It has a very strong what we call negative predictive value. It means that if it's negative, you can be very confident this person doesn't have heart failure at all. And so most guidelines now recommend you do that blood test first, and then with that blood test, if your suspicion is high, then you go over to echocardiography. And I think this is generally what we would place the echo in the future, how we would place the echo into our own algorithm. So because this is what the guidelines say that we should do. In a lot of cases, in our study, we found that many patients have either normal or low normal NT-proBNP levels, but already have some kind of structural abnormalities, but very early. Like I think doctors will be familiar with stage 1 diastolic dysfunction, meaning the heart becomes a bit stiff, but it's not really heart failure yet, or left ventricular hypertrophy, meaning that the heart wall is a bit thickened, but not really causing any problems quite at that stage. And the NT-proBNP test actually doesn't help you pick up these kind of things. So I think there is a role to be played for a variety of tests to help us to diagnose heart failure. I don't think that AI echo will end up replacing this test necessarily, especially because this AI echo technology has not been made widely available. Like if you were to ask me, I think some questions that I've gotten in the past were, because this technology is relatively cheap, could you ask some doctor in clinic kesehatan to learn something like this and scan in that area? I think a good internet connection is always necessary. Even in hospital, sometimes if it takes time for us to upload the images and all that, it takes time for us to get the report. I think that there are some barriers there. And there are other barriers that involve also in terms of studies. But in general, I would say there is quite good concordance between the conventional echo and the AI echo that we are getting. But when you add on additional tests to it, that gives you more clinical value, blood tests and things like that, then you will be a lot more certain that with easy diagnosis of failure.
Thank you so much, Dr. Nicholas, and thank you to all the audience for the very thoughtful questions and for your engaging responses. We have had a very insightful session learning how this AI echocardiography can change the way we detect heart failure in diabetes. With that, we shall now conclude our Q&A session. Now, I would like to present a token of appreciation to Dr. Nicholas on behalf of the organizers. So, may I kindly ask you to step forward. Ladies and gentlemen, can we give another warm round of applause to Dr. Nicholas? And then, before we take a break, a quick reminder to not forget to sign your attendance, and please help yourself with the light refreshment and beverages provided at the center of the hall. And we'll now take a short break before our next session. So just a gentle reminder, our next dialogue will start at 11 a.m. with Dr. Nur Shuhada. She is the registrar at UMMC for urology, and she will be sharing about living kidney donation and donor's kidney function. So please be here sharp at 11 a.m. as we continue with more inspiring research stories. So thank you and see you shortly.